Way back in 1996, the Seinfeld TV show told the story of the difficult patient. Elaine Bennis, played by Julia Louis-Dreyfus, developed a skin rash, but doctors kept refusing to see her. The problem was that her doctor had called her difficult after an appointment 4 years earlier when she had not wanted to change into a gown to get a mole examined. She wanted to have her chart delete this discredit, but the doctors wouldn't cooperate. Instead, they labeled her very difficult. So she worked with Kramer, who posed as Dr. Van Nostrand, to try to steal her chart. That backfired. She never got her diagnosis or chart, and even Kramer was written up in a medical record for impersonating a doctor. The segment is hilarious, and at the same time sobering, since it's a slice of medical life. See www.youtube.com/watch?VZ2MSARQSKU. Now, let's fast forward to 2 decades later. Doctors are still labeling patients as difficult. Patients are typically unable to see, let alone keep or contribute to their office visit notes about their condition and their body that they paid for. Frequently, they have to consult multiple doctors for the same condition. It may take weeks to get an appointment. The time with a doctor is quite limited, typically less than 10 minutes, and much of that is without eye contact because the doctor is pecking away at a keyboard. But a new model of medicine is taking hold, one that is democratized, not difficult, but easy. If Elaine wanted to have her skin rash assessed today, all she would have to do is take a picture of it with a smartphone and download an app to process it. Within minutes, a validated computer algorithm, which is more accurate than most doctors, would deliver by text a diagnosis of her skin rash. The text would include specific next steps, perhaps treatment with a topical ointment or a visit to a dermatologist for further assessment. Elaine could even download apps to see the ratings of nearby dermatologists, how expensive a visit would be, and even if the doctors themselves were difficult to deal with. When seen by a doctor, she could demand a copy of her office visit notes and also request to review and edit them, especially if she is mislabeled. Most likely, however, she wouldn't have to see any doctor. She'd have immediate access at any moment in time, at any location, to a diagnosis of her medical condition. She would not only avoid the delay, inconvenience, and unnecessary expense, but she wouldn't even have to find someone to steal her chart.